New session, and welcome to the first meeting of SSB. First thing we'll ask for, are there any requests for bill introductions? This is not something that we normally see a lot of. Seeing none. And we do have some staff movement this year, so I think we're going to go around and have staff introduction. Some of our members, our staff members, we're used to, but let's start with Francie and just go ahead and introduce. You don't want to introduce yourself? Well, this is, yeah, I think you should.
Okay. Francie Hernandez, this is my 11th year, lost it. 11th year with the legislative session, 2nd year with Chairman Mason, and I really enjoy it because I keep coming back.
Hello, everyone. My name is Jill Walters, and I work for the Reviser of Statutes office. You might remember last year that Scott Abbott was here, and Scott left our office and has a job at Johnson County now. And so Jenna and I are going to be helping this committee out this year. And just as a friendly reminder, if you need bill drafts or provisos from us, that we would sure be glad to help you. And I'll let Jenna introduce herself.
Good afternoon. I'm Jenna Meyer and work for the Reviser's office.
Dayton?
Dayton Lemunion, fiscal analyst with legislative research. I'm assigned to the Department for Aging and Disability Services and the state hospitals for mental health and for intellectual disabilities.
My name is Megan Leopold, also with Kansas Legislative Research, and my budgets are Board of Pharmacy, Board of Nursing, and KDHE Health in this committee.
All right. You're good, huh? Okay. Everybody say hi to Mr. Good. I'm sorry. Oh, and we have some staff in the audience.
Hello, I'm Amanda Prosser. I'll be presenting Department for Children and Families budget, as well as Board of Mortuary Arts. I'm with KLRD.
Hi, committee. My name is Molly Pratt. I'm also with KLRD, and I'm assigned to the budgets of the Healthcare Stabilization Fund Board of Governors, as well as the Kansas Commission on Veterans Affairs office. I look forward to working with everyone.
Hi, good afternoon, everyone. My name is Ariana Waddell, and I'm with Legislative Research, and I'm assigned the Kansas Guardianship Program.
Are there any others? All right. Thank you all. Thank you, staff, for being here, and thank you for being willing to put up with us. So when we set this agenda for this week, we have 3 very large budgets within our purview. And I wanted to hear from each of them over the next 3 days of the enhancements they had asked for as we went through this budget process. So today we'll be hearing from KDHE, and there's a presentation in your folder, so we can just kind of follow along with them. And this will be a really good opportunity for us to compare what their enhancement requests were, which ones of them did or did not get into the governor's final budget, and maybe we can delve into that a little more, why or why not, and proceed from there. So I'm going to call Janet up, and if you would present this to us, we would appreciate that very much. Thank you.
I'm not going to present, but I wanted to say thank you for having us today. I have people here with our team from the finance area that will present, and our whole leadership team is here to answer questions. Thank you.
Would you want to introduce them at this point?
Sure. We have our Chief of Staff, Matt Lara, our Deputy Secretary of Public Health, Ashley Goss, our lab staff, Paul. Oh my God, I forgot your last name. Paul Harrison, I should know that, I apologize. And Dr. Samir Sakala, our Director of Lab. Amy, my God. Amy will be presenting Penrod from Finance. Dan Timish, our Deputy Secretary of Fiscal Services. Christine Osterland, our Deputy Secretary for Medicaid and agency integration.
So, Madam Secretary, I understand this will be kind of tag team. Each one of them will present part of this.
Amy will present, yes, and then the Medicaid will present separately. Mark Heim. Thank you.
Proceed.
Hi, good afternoon. My name is Amy Penrod. I'm the Director of Finance for KDHE, kind of working with the public health and environment portions. So I will get started here on page, let's see, we really get started on page 3 here with a list of our 2024 supplementals. And we will go through each of these in a little bit more detail. I will be covering the public health supplementals and enhancements, and as the Secretary mentioned, Mark Heim with the Division of Healthcare Finance will cover the ones related to Medicaid. Okay, we are going to walk through each item that's included in the governor's budget recommendation first. So starting on page number 4, slide 4. The first one is adding $166,049 from the state general fund for the pay plan shortfall. You probably don't need a lot of reminder on this one, but this is related to the passage of the 2024 pay plan that was passed last year. Agencies were prorated their amounts by about 20% less. So we were asked to put this in our budget as a request so that we could be made whole for fiscal year 2024. Of the $166,000 requested for KDHE, $145,688 is pertaining to the public health side of the house, while the remaining $20,000 is over on the environment side. On slide 5, add $6 million or $6.2 million from the State General Fund for the Kansas Health and Environmental Laboratory one-time expenses related to the new lab. This is associated with furnishing and moving into the new facility that is being constructed, and you've seen go up on Lot 4 of the Capitol Complex. We do, because this is a brand-new facility and state-of-the-art, we do have some additional needs for equipment and things that we need to purchase to outfit that facility. You'll see that there's a supplemental request in fiscal year 24, and there's also a enhancement request for fiscal year 25. The supplemental request for fiscal year 2024 focuses on major lab equipment, furniture, and IT equipment. The reason for that is that lead times are such that we need to get those orders placed in order to maintain our schedule for finishing the building and being able to move in. Slide number 6 is the addition of $410,000 from the State General Fund, again for the Health and Environment Laboratory for equipment related to federally mandated water testing. This is to increase our capacity to test for per and polyfluorinated alkyl substances, or PFAS, you might hear. To be able to ensure the delivery of the safe drinking water, all Kansas public water systems have to be monitored beginning this month. And so this is, gives us the equipment needed to be able to handle that additional testing capacity. Slide number 7. This is the addition of $2.3 million from the State General Fund to replace our early childhood data management system. This system is currently operating on a temporary basis, but in order to provide a secure and sustainable solution, we have asked for funding to develop and implement a new system. This system tracks a lot of the data for the Part C early intervention services, for the Early Childhood Development Service Program. It tracks referrals and evaluations, services, health records, the billing of private insurance and Medicaid for some of this some of these individuals that we're serving. So it is an important system, and that's related to the development and implementation of that new system. Slide number 8 is adding 1.5 million. Oh, this is supposed to be Mark's. I'm going to turn it over to Mark before I get carried away. We'll switch just for a second.
Good afternoon, Mr. Chairman and members of the committee. I am Mark Heim, Finance Director for the Division of Healthcare Finance within KDHE. And slide number 8, as Amy was just starting on, this was a request from Healthcare Finance for $1.53 million for, it's our, what we call our employment data contract. And there's quite a lengthy description here, but the main point of this is that this is data, this gives us data that's required to determine Medicaid eligibility. And so we don't have the option to let this particular service lapse. It's used by a number of states, and my understanding is that we've heard from other states that they're seeing the increase as well, and it's been fairly significant. So again, a 1.53, that's an all funds request. 380, just about 384,000 is the state general fund request. And you'll see this in, we have a request for this as an enhancement in state fiscal year 25, that you'll see as well when we move forward to 25. With that, I think, Amy, I'll turn it back over to you. Thank you.
That is the conclusion of our supplemental request. So if you'd like.
And if you'll hold just a
Sure.
second, Representative Ballard has a question for clarification.
I should have pointed that. That name is a little deceiving because it's actually employment data for Medicaid recipients or those applying for Medicaid. So it's verifying employment in that area, not, don't think of it as, our employees, or it's not on our side, I guess, so to speak. But no, that's great. I'm glad you brought that up. Thank you.
We have a question from Representative Carpenter.
So that's a contract. Thank you, Mr. Chairman. Mr. Chairman. So that's a contract with who?
Equifax. Thank you.
Exactly. And so do you need this?
Yeah.
You currently have a contract with Equifax.
Right.
So this is in addition.
Yeah, because, and so I guess if it's fair, one way maybe I'd explain it is because of the cost has increased so much that we are asking for funding to continue this contract.
So it's not an expansion of the existing contract?
No, I don't think in any way it expand, no.
Okay. Equifax.
Equifax. Yeah, absolutely.
So I'm just to be clear, it's not an expansion of the existing contract that we have with Equifax?
Correct. The current contract ends January 31st of this year. We put out an RFP. Equifax was the only responder, exact same services that they're providing today. And this increase reflects their increased pricing that they submitted as a part of that bid. And this contract is used by both KDHE and DCF. It's federal government requires the income verification for both Medicaid and SNAP, and that's what this contract is.
Okay. As many of us know that they've been around here for the last 2 years wanting to expand the contract, and you weren't asking for it, so I'm like, something changed. No, we're good? Okay.
Yes.
Representative Ballard.
Department of Children and Families. Yes. Yep. Department of Children and Families. We have, Medicaid obviously has the bulk of the services that are provided, but they do some income checks as well through that Equifax contract that KDHE holds.
And to reiterate, this is required, this function is required by the federal government for Medicaid. All right. Yes. All right, thank you. Of the 2024 supplementals that you highlighted, were these all put in the governor's budget, or were there some that were left out?
The ones we covered were included in the governor's budget.
Okay.
Yes.
All right, please proceed.
Absolutely. Okay, starting on slide 9, that is our list of budget enhancements that were included in the governor's budget. Diving in, the first one is on slide 10, and it's the addition of $150,000 from the State General Fund for the migration of the agency's asset and hardware management to ServiceNow with our state OITS. The current system that we're using is actually in several different parts. It's not, doesn't connect very well and talk to each other, so we're using spreadsheets, SharePoint, and Access. We're hoping to move to the new system. It'll centralize and consolidate a lot of our hardware and software asset tracking. It'll help us track software on devices to maintain compliance with licensing audits and also prevent the overpurchase of equipment and software. On slide 11, the next one is the addition of $3 million from the State General Fund. Again, this is for the Health and Environment Laboratory one-time expenses. These expenses, again, are in fiscal year 2025, and they differ from the 2024 request in that we are focusing on moving costs, referral testing expenses, which is should we have to send out testing to an outside lab during the transition, that would be what that referral testing is all about. And then operating costs to operate both the new facility and the old one during the transition. We cannot be offline, so as things are moving, we'll be operating both until that transition can fully occur. Okay. Slide number 12 is the addition of $951,700 from the State General Fund for the laboratory, and this is for ongoing expenses, an increase in ongoing expenses for the laboratory. There are several things that operating the new lab brings to the table, including some additional costs. The first of which is increased rent to the Department of Administration. We do have additional computers and equipment associated with our data access and some of the connections. Lease costs for some of the bulk tanks that are holding our lab gases, argon and nitrogen. This also includes the state portion of tests billed to Medicaid to cover the increased cost of testing as well as an increased volume, and automated data logging system annual costs and staff training for staff retention. So that is something you would see in our budget beginning this fiscal year 25 and ongoing.
Representative Ballard.
Clarification. Now, is the new lab up and running, or we are preparing for it?
Currently, we are preparing for it. It is still under construction. They are estimating the building to be complete or substantially complete by the end of this calendar year. And then beginning next January, we're assuming we'll be able to start moving into the building.
So when we're looking at 951,000, we're looking at it in terms of increased rent to the Department of Administration. Okay, that's where I got confused about it. Why are we paying rent now if it's not up and running?
Beginning in July of 2024, we will have a period of time between, I think, January of 2025 and July of 2025 that we will be operating both the old lab at Forbes and beginning to operate and stand up the new lab. And at that time, we will be charged rent on the new space as well as the old space. And this is actually just the difference in cost between our current rent and what will be our new rent.
That explains it. Thank you, Mr. Chair.
Proceed.
All right. Page number 13. The addition of $1 million from the State General Fund for environmentally at-risk community testing. This funding is meant for a grant program to be implemented for testing in environmentally at-risk communities. That will require matching funds from private sources. It has been indicated that this has been added primarily for the 29th and Grove neighborhood, but could be used in other areas as deemed necessary if there are other sites of concern. Slide 14 is the addition of $370,000 from the State General Fund to continue the operations of the Bureau of Oral Health Services at KDHE. The CDC is changing its program focus, and Kansas is losing its funding for critical preventive services, such as the school sealant programs, community water fluoridation, just overall general oral health awareness, and then integrated healthcare practice models. So this funding will ensure the continuation of our existing programs, as they will no longer be funded by the CDC.
Representative Carpenter.
Thank you, Amy. Good to see you on a different side of the ledger, or whatever you want to call it. For you that may not know, Amy was with KDAS for a number of years, and I had her on speed dial, for sure. Amy, you skipped the bottom portion of 13.
I'm sorry. I did. I apologize. Okay, so we'll go back to slide 13. It's the addition of $1.5 million from the State General Fund to continue Bureau of Disease Control and Prevention Services. The Bureau of Disease Control and Prevention was awarded a 5-year grant to expand and train a response-ready workforce to combat infectious diseases. After the federal debt ceiling agreement in June of 2023, the funding for years 4 and 5 of that agreement were rescinded. The Bureau has done as much as they can to get through this current fiscal year, but we're needing kind of bridge funding until the next federal award period is available. That accounts for the addition of $1.5 million. And those dollars allow the agency to provide support and analysis for STI results. They can analyze that, determine if there are places where intervention is needed, and then send out disease intervention specialists in order to kind of contain an outbreak like syphilis, chlamydia, or other STIs.
And Representative Carpenter has a question on that.
On the last sentence here, improve capabilities while providing a wide swath of public health services to communities throughout Kansas. Explain, what is that?
This allows us to maintain that increased capacity. So while we are responding to the these outbreaks and these kind of hot spots in various places, they're able to still continue to provide the services that are maintaining across the other counties. For example, I believe over the last couple of years, there's been a couple of syphilis outbreaks, and they were able to respond to those while still maintaining services to the other 103 counties that weren't impacted by that.
And so were we not able to do that in the past?
In the past, I think resources were pretty limited. I can, if Ashley has anything to add, I will let her. But I think resources were limited such that when there would be an issue, an outbreak, or something that required a response, that kind of pulled resources away from other areas.
Okay. Well, where I'm going with this is, is this residual for COVID, after COVID? That's what I'm concerned about, is that we're inflating, and now, COVID's over, and we've kind of are building our bureaucracy, so to speak, with the excuse of it being COVID money. Thank you.
May I comment?
Ashley?
All right. Hi, everyone. Ashley Goss, Deputy Secretary for Public Health. So the problem hasn't gone away, and it's not because we had COVID funding. What there's an increase in syphilis, not only in Kansas, but across the United States, as well as HIV. We can provide you data if you would like for that. There's been increased testing that has been allowed to happen, such as rapid tests that can be done in the field when we actually find someone, which is what we can do, to where we're able to identify the cases faster. This is something that the federal government was funding even before COVID because it hasn't gone away. It has continued to increase. Syphilis is one of the things that we try and get ahead of pretty quickly because of the effects that it can have. And also if we have a baby born with syphilis or a pregnant mom with syphilis and we find out right before delivery, babies can die and have significant birth defects if they're not treated prior to being born. So this funding is allowing us to increase, I shouldn't say increase, and allow us to be available across the state because the locals at the local level cannot handle the capacity of what we're seeing. Currently in Shawnee County, we have a syphilis outbreak that has continued to rise over the last year. We're well over 100 cases, and that has led then into a hepatitis outbreak as well. Some are related. I mean, we can cross them in the disease investigation process, but these are very important diseases that we need to stop before they continue. And so this allows our field investigators to go into the field, find people, get the contacts, and treat them.
So this is a nice way of saying that, a wide swath of public health services.
Correct.
Okay.
I want to follow up on that.
Okay. Thank you very much. Oh, excuse me, Representative Ballard.
All right. That explains it. That's why I thought you were going, because I was trying to remember what I heard from the health department and the other issues they had. Okay, so this 5-year grant, were we granted this in 21 and it expires in 25, or did we get it later? The point I'm looking at is, when does that money run out?
Well, the money was supposed to keep us through 25, I believe, but with the federal debt ceiling, they pulled it back. They pulled back our last 2 years of funding. So we're held with syphilis and HIV cases going up and no funding to support the stop of it. Does that help?
Yes.
Okay.
I was trying to figure out which one, because I was thinking the money is about to run out, but then I knew they had withdrawn some of the funds. So
Yes.
I was trying to
They pulled 4 and 5, years 4 and 5, the last 2.
All right, that explains it to me. Thank you very much.
You're welcome.
Committee, other questions before we proceed?
Mr. Chairman, just so you know, I'm paying attention over here. I heard the term STI. It's not STD any longer, or is that just interchangeable? Thank you.
I think it can be interchangeable. And honestly, Dr. Clifford, I don't know when they switched it to STI, sexually transmitted infections would be equivalent to sexually transmitted disease, yes.
Yes, I'm not out looking for those things, so thank you for explaining that. Thank you, Mr. Chairman.
Yes, and it's good to know you are paying attention. Yes.
I'll verify. I saw him over there wiggling around.
All right.
Okay.
Please proceed.
Absolutely. Apologize for skipping that one, but now we can move ahead to page 15. This adds $2 million from the State General Fund for the Bureau of Family Health Services. This allows the Bureau of Family Health to expand and maintain Title X family health services throughout Kansas. It ensures that Kansans have access to critical health services, including contraception, chronic disease screening, pre-conception health care, and other family health services. Currently, The Family Health Program receives $350,000 in SGF, of which about a third of it is allocated to a data management system that we're required to maintain. So we have to keep that funding where it's at with the data management system. Slide number 16 is the addition of $1.4 million from the State General Fund for the Early Childhood Data Management System. I talked about this as part of the supplemental request. This is year 2 of that project. Again, we're operating a temporary system, but we'll need to develop a sustainable solution. Slide number 17 is the addition of $336,000 from the State General Fund for 12 electronic fingerprint devices. These are for the capture of individuals' fingerprints electronically. It saves a little bit of time and is a little bit more efficient on that end. Child care licensing requires, by federal and state rule, to collect fingerprints on all child care staff and working in the child care setting before they can begin employment or obtain a license. The plan would be to increase accessibility and improve our licensing process by placing these devices at different hubs throughout the state. It allows those individuals to be fingerprinted closer to either their place of residence or the facility that they work.
Quick question from
And
Representative.
so will that be able to be used by other agencies besides KDHE?
It would be my understanding that it could be, but I think working on placement and the availability, I know that there are other agencies that could benefit from that, and perhaps there's the ability to collaborate.
Well, background checks have been an issue
Mhm.
for quite some time, and the length of time that it takes to get those back, and maybe this could streamline that for KDADs or DCF.
Right.
May I?
Representative Ballard.
Thank you. Seems like we're doing a tag team over here today. But I think to answer part of that question, it says the law enforcement agency will share the secure results electronically with participating agencies and partners. So that's in a way, they may not loan it out, but they would be sharing it. So basically, if these machines cost roughly $2,400 a piece.
They are $28,000 a piece.
Oh, it's a piece, because it says to purchase 12 costs
Yeah,
$28,000.
$28,000 per item, which would then total the $336,000.
Whoa, okay,
Sure.
yeah.
And then the maintenance fee would be $10,000 per device annually in order to comply with the KBI.
Representative Ballard, let me add on. So these fingerprint devices would be used also with DCF. These allow us to take them into the field. So one thing that we've heard back on our child care listening tours as we were revising regulations this last year is the ability to be able to go in and get fingerprints, because everyone knows if you're a provider, you're probably watching kids during the hours that you could go in and get your fingerprints done. Also, with talking, some law enforcement agencies don't have the bandwidth to do outside fingerprints on top of the required fingerprints from their guests that come in to stay with them. So this is to improve that process. DCF can also use them in the field as well. And what we are looking at in partnership with DCF is where we can place them in the field. We're getting ready to do a project starting in March. Actually, we have 5,000 child care providers coming due for fingerprints to be redone. They have to be redone every 5 years. And so we'll be able to go into the field, have the service available on weekends and after hours when providers can come in and partner with local agencies to be able to make that happen.
That's helpful. I just missed the important.
Yes. And at this time, we don't know which machine it's going to be. KBI is going through a transition, and they are getting new machines. They have that out, but our cost should still be where appropriate.
Chairman Mason, thanks. So why are you requiring every 5 years that someone gets their fingerprint redone? What happens? Why is that needed?
To check to see if they've had a criminal history happen within that 5 years, to make sure the people that are watching your children are still safe and secure people as expected.
Wouldn't that just be a background check versus?
It's what the federal government requires us to do. I understand what you're saying. The federal government requires us to update the fingerprints every 5 years, which is that's one of the requirements in the money that comes to DCF, because as you might recall, the money that comes to our child care licensing program is a portion of the dollars that DCF gets to administer the program.
Committee, other questions on that point? Seeing none, we'll proceed.
Thank you. I believe we are on slide 18 now. This will be adding $1.3 million from the Children's Initiatives Fund for child care, health, and safety grants. These would be grants to assist child care providers with updating facilities to comply with health and safety standards. Again, that is from the Children's Initiatives Fund, not the State General Fund. And at this point, I'm ready to turn it over to Mark to talk about the Medicaid items.
Welcome, Mark.
Thank you again. Yes, so the last four 2025 enhancements requests are healthcare finance. So again, on 18, the bottom half there starts our first one. It says $900,000 all funds request for some additional positions within healthcare finance. And the areas we're looking to improve are, well, some of it's to meet federal requirements, and then we've identified some staffing gaps, and it'll help improve our MCO oversight. We certainly have a couple people here who can give you more details of the particular positions, but let me give just kind of an overview. These positions would fall within data, the area of data. We have, Medicaid creates millions and millions of lines of data. We work with data all the time, so that's a huge area for us. Credentialing, some of these would fall within credentialing, and then in our, what we call quality compliance and integrated health oversight, and that's the kind of a general overview of where we're looking to add positions. If you would like more specific details, we can surely provide that.
Representative Barth.
Thanks, Chairman. I have a question about how is this going to help reduce the folks that are on the IDD wait list? Is there any, does this even fall underneath that category?
I will defer if, do we, that'd be getting a little bit out of my finance area, but I appreciate the question.
Christine Osterlund, Deputy Secretary for Agency Integration, State Medicaid Director. So the pieces of it that would overlap, so KDADS has the IDD waiver, and that's under their purview and their budget, but where there is overlap is the MCO oversight component. That is primarily done through KDHE, and with the RFP that's on the street, obviously we're increasing requirements for our managed care organizations that we want to be sure that we're monitoring and staying on top of, that they're providing to us what they've agreed to in the contract to provide to our members and to the state. And then we've identified that even in the existing contract, we have some gaps in our monitoring of the MCOs. I don't know that that's necessarily uncommon as states mature in being a managed care program, that when you go into managed care, I think sometimes you think the managed care plans are going to kind of self-monitor themselves, if you will, and as you gain experience, you kind of learn that you need to make sure that we're doing our due diligence, that they're doing their part, and so there will be some overlap to our waiver, both children and adults, and ensuring that the MCOs are doing what they're contractually obligated to do for our members.
proceed, Mark.
Thank you. Moving to slide 19. So this is one we discussed a little bit earlier. This is the 2025 request, again, for the Equifax, or the employment data verification for Medicaid recipients.
Representative Carpenter.
Thank you. Thank you, Mr. Chairman. So we have Conduit that does our eligibility. They don't provide this?
Not this, oh, sorry, go
I
ahead.
mean, seriously, they don't do this when they do Medicaid eligibility?
And Representative Carpenter, thank you for the question.
Hello, Representative.
Thank you,
Yep.
Christine.
Yes, so the difference between the two is the data or the employment matching is a national database that primarily right now one vendor has the market on, that goes out to all of the private employers around the country and will pull down electronic data matching so we can try to determine if we can approve them without having the member have to take any action. And so that's different. What Conduit does is they actually take all that information, whether it's electronic matches coming in or documents that the member is submitting, and then they're evaluating all that to see if they meet the criteria. So they're really two different functions, but unfortunately right now there's really one company that provides a federally required service. And so we are kind of at the mercy of the pricing that comes in for our bid.
And that company is?
Equifax.
Thank you.
All right, proceed.
Thank you. Turning to slide 20. The first bullet point there on this is the last slide. The first bullet point is for Medicaid expansion. So add 714, just about $715 million, including savings of 61 million in state general funds, and this is for Medicaid expansion.
Committee
Okay.
questions at this point? Seeing none.
Thank you. And the final item is a $4 million all funds adjustment for, this is the cost adjustment factor for hospitals, for critical, specifically for critical access hospitals that handle, that work with Medicaid patients. And as the comment there points out, this cost adjustment factor had not been updated since 2013, so 10 years, I guess, going on 11.
Okay, questions, committee. Representative Carpenter.
How will that be done? How will you decide what decides that? Codes? We use codes?
I might
to add
phone a friend if I can. Do you want to, I know you've been in on some of the discussions, Dan.
Mr. Chair, members of the committee, Dan Timish. I'm the Deputy Secretary for Fiscal Services. Under the fee-for-service model prior to 2013, there was an annual cost settlement done with critical access hospitals. And the amount of that cost settlement and the funding was $8.8 million. After we transitioned into managed care, that got built into the rates. So it's prospectively set each year when we go through our actuarial rate setting process. And so the cost adjustment factor is individual for each critical access hospital. There's an inpatient factor and an outpatient factor, and those are, again, set by the actuary. And it's based upon their Medicaid cost report. So the concept is to, in partiality, make the critical access hospitals whole for the difference between the revenue that they received from Medicaid program versus their incurred costs. And so this $8.8 million is just carried forward into managed care, and it's been at that since that time. And the critical access hospitals, on top of this, continue to lose money. So this was requested by the Kansas Hospital Association to try and address that.
Very good, thank you.
You're welcome.
Committee, other questions? again, the 2025 enhancements that are listed here, they all made it into the governor's recs? Okay. All right. Well, committee, this gives you a kind of a preview of what we'll see when we see the fiscal analysis from the research department. Anyone from from KDHE want to talk about recommendations that were not put in? We'll see those eventually when we see the fiscal analysis. Is there anything that just jumps out at you that missed the cut?
Sorry. This is Amy Penrod again. No, nothing that jumps out, I don't believe. There were a couple of Medicaid adjustments for dental rates. There were a couple of pilot projects that were proposed, but nothing that I think, I'm not out over my skis, but nothing that we were concerned with.
All right, thank you. And committee, do we have questions on the presentation? Representative Carpenter.
Thank you, Mr. Chair. What about the agreement between KDHE and CMS for private duty nursing in the governor's budget?
I'm not sure that I am familiar with that. That may be on the KDAD's side of the ledger. It must be.
Care Medical, the increase of 109 million. This is in caseloads, but then after that, it says all funding sources increase partially due to expenditures to meet newly clarified federal requirements that certain medical services, including personal care and private duty nursing service, be provided to any child on Medicaid which meets medical needs requirements. Prior to receiving this clarification from CMS, these services were provided only to children on a qualifying waiver. So it's $51 million, all funds, 20 million.
So that is, under the federal guidelines for Medicaid, there's what's called the EPSDT requirement. It's early and periodic screening and diagnostic treatment for children. And what that requirement is that a child is eligible for any medically necessary service that can ameliorate or treat a condition, whether it's covered in our, what we always refer to as our state plan or not. Which means if we have a waiver service and it's only in the waiver, it's not available to everybody in Medicaid, but a child through medical necessity needs that service, they are required to receive that service. So that service should be available for waiver and non-waiver children. And Kansas got that clarification from the federal government that we've been out of compliance with that requirement, because there were some services that we limited to waiver children only when they should have been available to any child on Medicaid that met the requirement. And that's what that additional funding is for.
So that's not considered an enhancement?
Yeah, we did that through caseloads because it's a federal requirement. Yeah.
That's what I thought. We did it through caseloads. How did you arrive at the fiscal note?
So it was quite a challenge, but we looked at the children that are on the waiver and what their service level was. Then we looked at the children on the waiting list that are not on the waiver, but they're on the waiting list, assuming that they would receive a very comparable, probably need of services, so they would start receiving some of those services. And then we did a small fraction for children that aren't on the waiting list, figuring if a child is not on the waiting list for a waiver, their health needs are probably significantly less than a waiver or wait list child. But you're going to have maybe some examples where maybe a child has a catastrophic injury and maybe for a while needs to receive personal care services or something. So we added in just a small fraction for kind of the regular child population of Medicaid. But we primarily did it looking at the wait list children and looking at the fiscal of providing them more waiver services while they're waiting.
Very good, thank you. So you had an hourly figure times, what, $55?
Yeah, we took what the rate was and what the average, so if you're looking at, let's say, personal care services and they're getting 8 hours a day and the rate is X, yeah, it's basic calculations of the service times the number of hours that someone may receive on average on the waiver.
Very good. Could you get that calculation out?
Yes, absolutely.
Very good, thank you.
Committee, other questions to the department? Seeing none. Well, this information should be helpful to you, committee. Just hang on to this. We will actually have the budget hearing within a couple weeks, and you can kind of compare this to what that analysis is from our research department, and we shall move from there. The next couple days we'll have again a similar process with our other two large budgets. KDADS and DCF, not necessarily in that order, but that will give us kind of a preliminary head start, and we can kind of look at things when we actually do look at the budget. So if there's nothing further from the committee, thank you, department. Oh, yes. Okay, I just want to thank the department. Thank you, Madam Secretary, for bringing your staff and having them go through this with us. So we appreciate it greatly. We are adjourned.